Hi there, this is Dr. Ted Kramer and this is Baby Harrison. We're here today to discuss the 2-week well child visit. If you don't know me, my name is Dr. Ted Kramer and I'm a primary care pediatrician in St. Louis, working in the North County and St. Charles areas. I've been practicing for over 2 years. Before that, I did my training at St. Louis Children's Hospital for Residency, which is affiliated with WashU, and SLU for medical school. I am also an assistant professor of pediatrics at Washington University here in St. Louis, and I teach residents primary care. So today we're going to talk about the 2-week video, the 2-week visit with this virtual visits with Dr. Ted. If you want to know more about me, we have lots of other videos on my YouTube page and on my Facebook page. There's virtual tours of the office, there's a podcast to get to know Dr. Ted Kramer, and a lot more information about us. So this is Dr. Harrison. This is Baby Harrison, and I'm Dr. Ted, and we'll get started with this visit. So we'll see you soon. We're going to go ahead and ask all the questions that the doctor would be asking you at the 2-week visit, and then we're going to feature Baby Harrison for the exam. So Baby Harrison will be back in just a couple minutes for us to do the exam. So let's go ahead and get started. All right. Well, I am back again. There are a few main sections of the well visits for pediatrics. The first one is the history, which we'll do now. The second one is the physical exam, and we're going to get back to the star of our show, Baby Harrison, for that. And then we'll talk a little bit about anticipatory guidance and what to expect until the next visit. So for the history, the first thing I always ask parents is, what brings you in today? What concerns do you have about your baby since your last visit? So we'll talk about any new rashes, any new concerns that the parents have at that part of the visit. And then we'll talk about we'll readdress anything from the previous visit. So the visit prior to the 2-week visit is the newborn visit, that 3 to 5 day old visit. If there's anything that we talked about for your baby, any concerns you had at that time, any diagnoses we made, we'll discuss those. We'll also discuss if there were any complications with pregnancy or delivery. We'll talk about those things at the very beginning of the visit. Once we've talked about all the new acute concerns, the next thing that we will move to are all the things we have to talk about for happy 2-week-old babies. So the first thing is the weight. How is the weight doing? That's one of the most important things that we check at the 2-week visit. Our goal is for the baby to be back up to birth weight by the 2-week visit, okay? So it is normal for babies to lose weight in that first week of life, up to 10%, but then they should start regaining that weight about an ounce a day, and by the 2-week visit, they should be back up to their birth weight. So that's one of the big things we're checking today, the weight today versus the birth weight. If the weight's above birth weight, wonderful, nothing to worry about. If it's a little below, we'll talk about strategies to help increase that weight. Like, do we need to, if you're a breastfeeding mom, do we need to have you breastfeed and then pump afterwards and supplement after each feed, whether that supplements with breast milk or possibly sometimes with formula. We like to use breast milk first if we can. And then if you are bottle feeding, we talk about how are the feedings going? How much are you giving? How often? Is it on a schedule? Do you wake the baby every 3 hours or every 2 hours to feed even at nighttime? So those are things we'll talk about if the weight's a little bit down. We don't worry too much now if the weight's down, but we'll have you follow up in a couple days with a weight check. And if it's still down after a weight check or two, then we'll talk about more what else we need to look for. So we'll also look for a few things on exam that may give us reasons why the baby's not gaining weight. But the big thing about the second week visit is the baby above birth weight. So that's huge. Next thing after we take a look at that weight, we are going to talk about how the baby's feeding. So that's one of the most important things too for babies is they feed. So breastfed babies should feed about 8 to 12 times a day. Again, that's about every 2 to 3 hours, but some babies cluster feed, especially at this age. So they'll feed a whole bunch in a row and then maybe go a little bit longer periods of time without feeding. Breastfeeding can be really, really challenging. Know that for a lot of moms and for a lot of babies, it can take a week or so for the baby to really get a hang of it, to get that good latch, that good suck, and really for that breast milk to start coming in, usually about 3 to 4 days, but sometimes it can take longer for moms. So if you have concerns about breastfeeding, we do have a lactation consultant, many lactation consultants at ESSA Health throughout the different offices, and we can get you in touch and get you an appointment with a lactation consultant. But I'm also happy to give many tips about breastfeeding at the office that help a lot of moms, but sometimes we do have them see a lactation consultant if parents are really struggling with breastfeeding. Know that's one of the hardest jobs for a new mom. Breastfeeding can be very, very challenging. Know that that's normal for it to be challenging. I know it's not easy, but know that we're here to help if you need it. So that's breastfeeding. Formula feeding, usually by the 2-week visit, they're increasing the volumes that they take at each feed. So by now they should be taking at least 2 ounces each feed. 3 to 4 ounces is normal as well. And that should be about every 3 to 4 hours, day and nighttime. Both with breastfeeding and formula feeding, they should be feeding during the day and night. For formula, the most important thing to me is that the formula has iron. Many babies don't get enough iron, and that causes anemia. Anemia is a low red blood cell count. You need iron to make red blood cells. And low red blood cells is not good for babies because those red blood cells are what carries oxygen and nutrients to the body and the brain. And the developing brain especially needs red blood cells because it needs oxygen and nutrients. So there have been a lot of studies that show that kids who have anemia do not do as well later on. And so therefore it's really, really important to make sure that formula has iron. Some moms say, well, does the iron make them constipated, fussy? Well, all the studies show that formulas with iron have no significant difference with formulas without iron or with low iron in terms of fussiness, gassiness, crying, colic, constipation. So all of those things should not be a big worry. That iron is really important in the formula. Other than that, any formula with iron is going to be a good one. If you want to talk specifically about which formula is best for your baby, I'm happy to talk to you about that. But there are lots of different options out there. But again, the most important thing to me is that it's a formula with iron. Next up, I like to talk a little bit about vitamin D. So that kind of goes with feeding. Formula is good, not as great as breast milk. Breast milk is best because it has lots of benefits to help prevent infections, has lots of benefits for long-term outcomes for kids. And so it's really good for bonding too. Feeding is a great time to bond with mom. So breast milk is best. Formula is right for a lot of parents though. It's not the end of the world if we have to use formula. For our baby Harrison, we do supplement with formula sometimes after a breastfeed or after we run out of the pumped breast milk because he's still hungry, and a hungry, starving baby is not good either. So, for some moms, formula feeding's right. And, even though they don't talk about it a lot, sometimes moms do just not create enough milk. Some moms, they just have failure to get a good milk supply, and that happens, and that's okay. Formula-fed babies are going to be fine too. I don't want you to stress out too much if it doesn't go perfectly. Try hard, keep trying, because it took us a long time. It took us almost a week for the feeding to even get a good latch and a good suck. So know that it can take time, even for people who have studied this and have worked with kids for a long time. So just know that about feeding. Next, I was saying before, vitamin D. So breast milk has everything a baby needs. It's the best for a baby. Formula also has all the right nutrients. The one thing that breast milk is missing is vitamin D. The reason for this is because babies used to get enough vitamin D because there's actually 2 ways that our body can get vitamin D. Number 1 is from our diet. Number 2 is from the sun. So now that humans live live inside buildings, we don't get as much sunlight. Before humans lived inside buildings, there was plenty of vitamin D for babies just through the sunlight. So now, because we live inside and we do think this is best for babies, and too much sunlight in a short period of time can actually harm baby skin, so it's actually good that they're inside. We do recommend supplementing with vitamin D once a day. What does vitamin D do? It helps create strong bones, prevents something called rickets, which can cause bowed legs. A little bit of bowed legs in infants about a year old or up to the first few years can be normal. Talk to your pediatrician if you're worried about bowed legs. They'll be happy to look to see if they're low on vitamin D to make sure it's not rickets. But know that for strong, healthy bones, we need vitamin D. The amount we need, just so you know, is 400 units once a day. So those vitamin D drops should be started by the 2nd week of life and then do once a day up to a year for all breastfed babies. For formula-fed babies, they do need it when they're infants too. There is some vitamin D in formula, but know that babies need to take 30 to 32 ounces of formula a day to get enough of vitamin D. So if they're taking less than 30 to 32 ounces of formula a day, it's still good to supplement with vitamin D. And even if they're taking that much formula, supplementing with vitamin D is not going to harm them. You're not going to give them too much. It's still safe. So I recommend that all babies use that vitamin D up to a year. If moms want to stop who are formula feeding and they're taking 30 to 32 ounces a day, I say it's okay. But again, I recommend vitamin D for all babies. Print out a calendar, post it on your refrigerator, put it somewhere that you can check off each day that you gave the vitamin D, because sometimes it can be hard to remember if you gave it or not, at least for me with Harrison. I printed off a calendar and this is helpful. So that's vitamin D. Next thing I talk about, and going along with feeding as well, is spit up. So now is when we're going to start to see a little more spit up, probably than the first visit, just because the baby's taking larger volumes. More volumes in the stomach means a little more spit up. So things that we're going to look at is that spit up shooting across the room? Is it bright green in color? Is there blood in it? If any of those things happen, definitely call your pediatrician right away. It's really important. But the rest of spit up is normal, and expect your baby to spit up with every feed. Expect sometimes for it to come out the nose. That can be normal too. Expect it to be clear in color, white in color like formula or breast milk, or expect it to even be liquidy, or it can be chunky. All of those things can be normal for spit up. As long as your baby's gaining weight, or by 2 weeks of weight back up to birth weight, that spit up's normal. So just know that. The other thing that we want you to know that we talk about, kind of go along with feedings, is bowel movements. So comes in one side, gonna have to go out the other. We talk about normal bowel movements, how the baby's doing. At this age, there can be a huge range of normal. Some babies have 6, 8, maybe more. A lot of babies have 1 or 2 a day at this age. Know that 2 weeks to a month, that number of bowel movements starts to decrease, and that's normal. It's not constipation. As long as the consistency of the bowel movement is what we expect. So what we expect for consistency of bowel movement, again, I like to compare bowel movements to food. I apologize if that's gross. So normal can be really loose and runny, kind of like a very runny mustard, a liquidy mustard, all the way to mashed potato consistency, all the way up to peanut butter. It's kind of firmer but soft. That's all normal consistency. So if you notice that consistency, it's probably not constipation, even if the baby goes a while without a bowel movement. And then the other thing that we say is the color of the bowel movement. So we want it to be yellow, green, or brown, or a combination of those colors mixed together. That is normal. Oh yeah, the bowel movements can also, with the consistency, be that seedy mustard-like. So kind of liquidy with some seeds in it. That's normal too. Or some seed-like substances. How often babies should have bowel movements? As I said, they can have a lot a day. They can go multiple days without a bowel movement. As long as they're soft, it's not constipation. The reason why they're not having a bowel movement every day, even though you're feeding them a lot, is because they're using all those nutrients to grow. They're absorbing all those nutrients. As adults, if we went a few days without a bowel movement or up to a week without a bowel movement, it would probably be painful. For kids, it's not the same. Know that 2, 3, 4 days is completely normal. All the way up to a week without a bowel movement, I don't worry about, as long as the baby's happy and healthy and not fussy because of that bowel movement. Know that when babies do have bowel movements are a very coordinated effort. So when we as adults have a bowel movement, we do a maneuver without even thinking about it. That's actually kind of complex. You take a deep breath in, you hold it, and you push down. That's called the Valsalva maneuver. That's how adults have bowel movements. Babies aren't coordinated enough to do that yet. So that for them to push out the bowel movement, what they usually do is they make grunting noises that can sound like crying noises. So if you think about grunting, you're holding that air in and pushing down. Well, that's what the baby's doing when they're grunting too. It doesn't necessarily mean it's painful. It's just their way to get the bowel movement out. So know that just because they're grunting, if the bowel movement's soft, it does not mean it's constipation. Really important to know, because that can be scary for a lot of parents. So that's bowel movements. Wet diapers. This is really, really important for us. This is how we know if the baby's getting enough to eat, in addition to whether or not they're growing. If they're having 3 or more wet diapers a day, that's normal. Most babies will have many more than that, but as long as they're having 3 or more, we know that they're well hydrated and they're getting enough to eat. So that's going to be really important to watch out for too, the number of wet diapers per day. Sleep, and that's the next thing that we talk about. Again, safe sleep is going to be really, really important. Sudden infant death syndrome has been the cause of death for many, many babies over the years. When they introduced the Back to Sleep campaign 20 to 30 years ago at least now, the number of sudden infant death syndrome decreased, but it's still around and it is still real, and babies do die from it. So these sleep suggestions are not just suggestions, they can be life-saving techniques for your baby. So please, 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 even though it can be challenging for parents, please follow these safe sleep recommendations. So the first one is babies should sleep on their back. We say the A, B, C's of sleep. The A is alone, so not in the parent's bed, should be in their own crib or bassinet. B should be on their back. If they roll to the side, that's fine. If you see them on the side, it's okay to put them right back on their back. If they're on their stomach, again, put them on their back. And they should stay on their back until they're able to roll over. I say both ways, but if they're strong enough to roll over on their own, if they do somehow on their belly get their face on something where they can't breathe, they're going to be strong enough to move not only their head but their body. So again, once they're old enough to roll over both ways, then they no longer need to be on the back. But at 2 weeks of age, it's always going to be back. They're not strong enough yet to be on their stomach. And then C is in their own crib or bassinet. That's really, really important. A couple other really important things about safe sleep. They can wear the normal clothes they have, the onesie, pants, socks are fine. Swaddled in one blanket or one swaddler, there's lots of different types of swaddlers out there, is fine. But there should be nothing else in the crib, okay? So no pillows on the side. There shouldn't be any other blankets in the crib. No stuffed animals in the crib. Just the clothes, the swaddle, and the baby. So that's going to be really, really important too. If you have a cat or another pet that you think might jump in the bassinet, they do make bassinets that have kind of like an umbrella hood over it that you put the baby in the bassinet and then you put the umbrella over it and you can zip it up. We have one of those because we have a cat. And we want to just make sure bassinets seem like boxes. Cats love boxes, and we want to make sure that our cat doesn't jump in the bassinet thinking it's for them. So that's really important safety tip too. So safe sleep, really, really important. Another thing with sleep, you want to put your baby down. So a lot of times the baby's going to fall asleep in your arms. That's great. We want that bonding. We want you holding the baby as much as you can. That's going to help create great brain development for the baby. Each time you hold and cuddle and swaddle your baby, the brain connections are forming and you are helping your baby grow and develop. So holding your baby is great. It's okay if the baby falls into your sleep, sometimes even most of the time. However, we are going to want you to train your baby to learn to fall asleep on his or her own. Reason why is because if a baby only can fall asleep in your arms 100% of the time, that's great when the baby's little. But as the baby gets older, up to a year of age or older, it's going to be really tough on the parent and the kid because it's going to be tough if you have to hold them to fall asleep every single night. That's going to be really, really hard. And then when it's going to be harder for the baby to learn to sleep through the night. So what we recommend is not every time, but at least sometimes when the baby's about to fall asleep and like drowsy and in your arm, but not quite asleep, put them down in their crib or bassinet on that hard surface and let them fall asleep on their own. So let them fall asleep on that hard surface on their own. So again, putting your baby down drowsy but awake, I'd probably say do it once a day or at least do it every so often because that helps them learn to fall asleep on their own and not be dependent on falling asleep in your arms, which is great for them to fall asleep in your arms most of the time. But again, learning this skill is going to be helpful later on when we want to teach the baby to sleep through the night and when the baby gets to a year or older, where it's really tough to really hold a big old child in your arm falling asleep every single time they need to take a nap or go to bed at night. So those are going to be some pro tips for you, putting the baby down drowsy but awake. Next thing we're going to talk about after that is going to be development for the baby. What should a 2-week-old baby be doing? There's only a couple things that we look for at this age. The first one is regards face, so you can tell the baby's looking at your face. For baby Harrison, we can definitely tell this at this age. It's really great. He's definitely looking at your face. If you see a social smile, like smiling back at you, that's okay, but we wouldn't expect that quite yet. But if you see it, wonderful, wonderful. Moving both sides of the body equally, so should be moving both arms and legs. We do want to see that. If they're not moving one arm or moving one arm a lot more than the other, only keeping their head pointed in one direction, we want to make sure they can move their head back and forth too. That's really, really important as well. And then the next thing is tummy time is really important. So the baby should be on the tummy at least once a day. My rules for tummy times are 2. Number 1 is when you do tummy time, someone has to be around and watching the baby at all times. You can't walk away, walk outside the room. And number 2, if the baby falls asleep, you need to flip them back over onto their back. So someone watching, and if they fall asleep, on their back. But otherwise, they can be on their tummy as long as or as short as they want to be. A lot of babies at this age don't like to be on the tummy very long or much at all. But if that's the case, still give them 20, 30 seconds just so they get the hang of it, because it's really important for their development, because they're going to learn to move their neck, pick up their head. They're going to, by 2 months of age, they're going to be pushing up with their hands when they're on tummy time. And that's going to help develop muscles, muscle tone, muscle strength. It's going to be really good for development. So tummy time is great. That can be on a hard surface, can be on mom or dad's chest too. Both of those are fine, but we do want to do tummy time. And then the next developmental milestone is by 2 weeks of age, when you give them tummy time, they should be able to lift up their head and look around. It doesn't have to be for long. It can only be for a second or two, but they should be able to lift up their head when they're prone, which means lying on the stomach. And then the last thing that we look for is, do they respond to sounds and noises? Again, this is just to help make sure that their ears are working. We'll probably also ask you at this time is, did they pass the newborn hearing screen at the hospital? But if they respond to sounds, that's great. Well, what is responding to sounds? A loud noise might make them cry. A loud noise might make them look over, look at mom. Things like that, that's what we're looking out for at 2 weeks. Those are really the big things I expect a 2-week-old to do. So for developmental milestones, we say, are they doing what they should at this age? And a 2-week-old should eat, sleep, poop, pee, and then the things we talked about, move both sides of the body equally, should look at a mom's face, should lift their head with tummy time, should respond to sounds. Those are the big things I'm looking for at 2 weeks, so that's really, really good. Next, we'll talk a little bit about safety. A few things that are going to be really important with safety. Rear-facing car seat. That's going to be all the way up until age 2. Rear-facing car seat is important. Car accidents are a huge, huge cause of injuries and death for children. So please, please, please follow the car seat recommendations. Avoid sun exposure at this age. Again, I remember I said vitamin D can be helpful, but we're supplementing with that. Sun exposure for skin. This baby skin isn't quite ready for a lot of sun exposure. If you're going to be outside for a few minutes, that's fine, but if it's going to be longer than 15 minutes, 10, 15 minutes, put that cover over, especially in the summertime. I think that's going to be really, really important. Next, what we're going to say is we don't want to burn the baby, especially now that the baby's probably starting to take baths. If your house does have a hot water heater, there's usually a thermostat on that hot water heater, then you can usually set the max temperature. If that's the case, set it to 120 degrees or lower. Higher than that can be a cause of babies getting burned. Make sure no one smokes in the home. If someone does, try to quit if you can. I know that's not easy, much easier said than done. If you're working on quitting, one thing that you can do to help the baby, because smoke is not good for babies' lungs, it's not good for babies who are around smoke, get more infections, lots of bad outcomes for babies around parents who smoke. Again, it's not the end of the world. Do your best to quit. And the safest thing for you to do if you want to prevent that baby being exposed to that smoke is, if you do smoke, go outside to smoke, wear a jacket, smoke outside, and then when you come inside, make sure you take that jacket off, like in the garage or outside, and don't bring it back in, because that smoke can stay on your clothes, and if you're holding the baby close to you, they can still get that smoke exposure. So do everything you can to decrease the exposure. Hopefully you'll have none at all. And if you want to talk to your doctor, the mom's doctor, about ways to quit smoking, I would highly recommend that too. Again, we're here to help you. We just want to help give you the information to keep your baby safe, happy, and healthy. And so that's why we make these suggestions. Another thing that's really, really important in terms of safety that we're going to talk to you about, and I know everyone knows this, or I hope everyone knows this, but we talk about it for every parent, every time, no matter what, is never shake a baby. Of course, you can sway them back and forth, and you can do some shorter, faster sways, but never shake a baby. That is going to lead to brain bleeds, long-term bad outcomes, can lead to strokes, can lead to baby death, it's one of the worst things you can possibly ever do for your baby. So if you're frustrated, which all parents get frustrated with crying babies, every single parent does, you can leave your baby there if they're crying, walk away for 10 or 15 minutes, take your time to calm down, and then come back. That is safe. Know that, and that will help protect your baby as well. Another thing that's really important, especially with the pandemic that's going on now, but even before the pandemic, babies' immune systems aren't ready until they're 3 months old. So before 3 months of life, I always recommend avoiding large crowds. So no hockey games, like no Cardinals or Blues games, no other big events. Avoid taking your baby to places where there's going to be large crowds. If people do come over, try to do as small groups as possible. Make sure they wear a mask when they come over. If there's a pandemic, make sure they wash their hands before they hold the baby. And if they have any symptoms at all, even if they think they're allergy symptoms like runny nose, sneezing, they should not be holding the baby. They probably shouldn't even be in the same house with the baby. Of course, if it's a parent, there's nothing you can do about that, but do your best to control your allergy symptoms. That's going to be really important, because if the baby does get an infection, even a simple cold can be life-threatening for a baby, because the baby's immune system isn't ready to fight it off. Those cold germs for babies can easily spread to the blood, which can spread to the brain, can spread to other places. So before 3 months of life, you want to be extra careful about making sure they don't get sick. So that's going to be really, really important. Those are the big things I'm going to talk about in my history. Again, I'm being very thorough on this video. It'll probably go much quicker in person, but those are the big things I'm going to be looking out for at 2 weeks. So next we're going to go ahead and grab baby Harrison. We're going to go ahead and do our exam. I'm going to go head to toe with it, probably a little quicker than our last visit because a lot of the things are the same. But we're going to make sure that everything's looking good for our baby Harrison here. So I'm going to go grab him. I'll be right back. Hi there, this is Dr. Kramer here with baby Harrison, who's all swaddled up. If you want more information about how to swaddle a baby, see my video on YouTube, the Dr. Ted Kramer channel, entitled Swaddling 101. So baby Harrison's here for the exam. One last thing I did want to tell you about history, and another really important thing is that we are going to ask mom to see how she is doing because it is challenging. Not only did you just give birth, which is exhausting, which takes a lot to recover from, but now you're waking up every 3 hours to feed, even at night. So sleep deprivation is common at this age. Being tired and exhausted is common. Therefore, we just want to check in on mom, make sure she's doing okay. Accept all the help you can. If dad is around and available to help, use him as much as you can. Use family members if they offer. But make sure that you nap when the baby's napping because all that can help. But we are going to ask you about sadness. Make sure you don't have any postpartum depression. Again, this is often the happiest time of your life, but the most exhausting. And that exhausting can make that happiness go to sad pretty quickly. So we're going to ask you about that. We may also give you a questionnaire called the Edinburgh Postpartum Depression Screener. We'll definitely give you that at 2, 4, and 6 months of life, but we often give it at 2 weeks too, just to check in to make sure mom's doing well. If you're struggling, there's a lot of things we can do to help. Make sure you talk to one of your doctors, whether that's your OBGYN or your pediatrician, whoever you feel more comfortable talking with. But there are a lot of support groups, mom groups who get together. There are also counseling and therapy if you need that as well. So there's lots and lots of resources out there, but we're happy to help you if you need that. But that's the last thing for the history. For the exam, the first thing I'm going to do is look at those vitals. The weight, we already talked about that, needs to be above birth weight. The length, we're going to measure the length today to see if he or she is growing. But if not, it's not that big a deal. They are growing in terms of length. The big thing is sometimes the measurements aren't always the same if they were taken at the hospital versus the office. The way to do a length measurement is measuring from the top of the head down to the bottom of the heel of the foot if the foot's all the way extended out straight, which can be hard to do if a baby's fussy because they try to bend their knees, they don't put it out straight. The leg needs to go straight forward, not out to the side, not middle, and the head needs to be straight, not out to the side. So that can change the measurement quite a bit. The height we don't look at quite as much. The head circumference is really important to us. If the head size is growing too fast, we worry. So we do watch the head size as well. That is the vitals for today. Here's our star of our show, baby Harrison. We're going to go ahead and get his exam going today, and I'll tell you head to toe what I look for. The big thing here that I want to first show you is a few things on his face. Normal newborn baby rashes, but just in case you see them on your baby, we'll talk to you a little bit about those. So let me see if I can get a good view of it here. Of baby Harrison. So on his nose, he's got some white dots. That's milia. On his cheeks, you can see a little on this side, a little on the other side too. On his cheeks, he has some neonatal acne. So this is a rash that are bumps on the cheeks with white dots in the center. They come at about a week of life, can last about a week or two, and go away on their own. They're from hormones from mom, just like acne in teenagers, go away on their own. But again, white bumps, this usually doesn't irritate the skin, and it will go away on their own. Another rash that can be on the cheeks in babies is eczema. Usually develops between 2 and 6 months of life, but sometimes down to 2 weeks. These are fine red bumps, kind of like sandpaper-like red bumps, and they irritating, cause the baby to be fussy. If you notice a rash like that, it might be good to see your pediatrician because treating that can help with fussiness. So we're going to go ahead and get started here. I'm going to set our baby down. Baby Harrison. We're going to go ahead and change the camera view a little bit so you can see head to toe. So first thing we're going to do, again, never set a baby on a flat surface where you can't watch or hold them, so don't walk away from a table like this. If it is like a bassinet or a crib or something with sides to it, it is okay to put the baby down and walk away. But again, if it's just a flat table, surface off the ground, we don't want them their first time to roll over to be off the table and onto the ground. So this is baby Harrison. First thing we're going to do is check the soft spot here. I'm going to give him a little pacifier too, see if we can get him to calm down a little bit for the visit. So check the soft spot here and here. Again, the soft spot on the top, sometimes that can bulge up and down. vibrate up and down. That's just the blood flow flowing through it, and that can be normal. Feel the head. We're going to take a look at the eyes with our otoscope and ophthalmoscope. So the ophthalmoscopes for the eyes will look for the red reflex as we talked about last time. We use the otoscope to look in the ears. Unfortunately, I don't have my portable one with me here today. It's back at the office. We'll look in the nose. We'll look at the face for rashes. I come back to the throat at the end because they're fussy when we try to check the palate. The gag reflex is no fun for adults or babies. I'm going to feel the neck for clavicles for lumps and bumps as well. The clavicles are the bones in the neck, are on the top of the shoulders near the neck. Those can get injured in delivery, so we just want to feel those to make sure there's no fractures. I'm going to feel the breast tissue. Babies can, both boys and girls, have a little bit of breast tissue. That's for mom's hormones. It will go away in a few months and come back later. We're going to listen to the heart and lungs. If the baby's screaming, that's really helpful for listening to the lungs. Nice, big, deep breaths. For the heart, it's good for them to be quiet, but we can still hear the heart even if they're screaming. We're listening for murmurs. That's normal. We're looking at the hands. 5 fingers, 5 toes. We're looking at the creases of the hand. We're looking for rashes on the skin. We're feeling the belly. Feel where the spleen would be on this side. The liver would be here. Feel for any lumps or bumps. We're looking at the belly button cord. If it hasn't already fallen off, sometimes the doctor will take it off at 2 weeks and put a little bit of silver nitrate medicine there if it's oozing. If the belly button cord is oozing, talk to your doctor about adding silver nitrate at the office to make it stop oozing or bleeding. Again, we want that belly button cord to fall off by 1 year of age. I'm not going to go ahead and take off his diaper today. A few things we look down below for. In boys, we check their testes to see if they're descended. If not, that's okay at this age. We give them time. We definitely want them to be descended by a year. We take a look at the circumcision to make sure that's well healed, and his is. It no longer looks that beefy red color. It looks more like the normal tissue. We'll feel the pulses down below, what we call the inguinal pulses on each side, right by the hip there. He's starting to get a little fuzzy here. And then we'll check the hips for a boy. For a girl, we'll take a look. A little bit of discharge is normal, white or clear. And then we'll check for diaper rashes as well. We'll check the bottom to make sure that's all normal. We'll look for rashes or skin tags. We'll check the hips with Ortolani and Barlow. Again, the hips are ball and cup joint. We want to make sure that the ball is in the cup. Sometimes with the hip, it can be out when they're born. So we check for that. That's called dysplasia of the hip. We're going to check his hips real quick. He might be a little fussy while I do this, but we'll go ahead and do it. So pushing down and back, and then up and out. Checks the hips. We check the toes for 5 toes on each side. We check what we call the plantar response, which is a normal reflex. We'll check a couple other reflexes. We want to check their suck. We want to check the plantar grasp, where if you put your finger right here on the toes on each side, they should try to grasp it. The palmar grasp, where you put your finger right here. They'll hold your palm. We'll check one called the Moro, which I like to call the yay response, where if you pull up on their arms and then let go, you don't want to drop them, but you want to pull up so they're pulling back against you, and then let go. They should put their arms up and out. He did a little bit there, and he would do it. Again, he's a little fussy now. We'll check it one more time. Here we go. Up and out. Perfect. That's a good Moro response. We check for rooting, so if you touch their cheek, they should move their face over towards you. These are all normal newborn baby reflexes. The last thing we're going to do is check their throat. So we get a tongue depressor. We take out their pacifier if they had one. If not, push down their tongue and just take a look at the back of the throat and make sure there's no cleft lips or palates. We're going to look at their back. Again, just make sure on their back that their skin's normal. We're going to feel along the spine, head to toe. Take a look at their bottom too. I'm not going to look at that now. That is usually the exam at 2 weeks. It should take a little quicker than the first one at 3 to 5 days. Just making sure there's no new rashes, no new problems. But Harrison looks wonderful today. So I'm going to go ahead and get him swaddled up and back to mom, and then we'll talk about some anticipatory guidance, which are some things to look out for between now and your next visit.
Hi there, this is Dr. Kramer. I'm back again to talk to you about anticipatory guidance for the 2-week visit. We just finished seeing baby Harrison for his exam, and he's happy and cute and doing well. And now we're here to talk about anticipatory guidance, what to look out for from now, the 2-week visit, until your next visit, which the next well healthy visit for most babies is at 2 months of age, okay? So anticipatory guidance, what things to look out for. The first thing that we are going to do is we're going to talk to you about reasons to come back, call our office. So those are similar to the 3 to 5 day appointment. Fever greater than 100.4. Okay, when you check fevers, best place to do this is underneath the armpit. The forehead and ear thermometers are okay, but not great. Those temperatures are not always reliable in a 2-week-old baby. Rectal temperatures are okay too, but I prefer to avoid those and only do them as last resort, because sometimes you don't want to injure the bottom, you don't want to cause any rectal bleeding, and so I try to avoid rectal temperatures when we can. Armpit is the best, forehead and ear is okay, but again, if you see a high number, don't worry too much. Make sure we repeat that either with a armpit thermometer or a rectal thermometer. So that's fever. Again, their immune system is not ready until they're 3 months old, so if they have a fever, it can be an emergency for babies. You need to call your pediatrician's office that day or right away if you see that. And if it's in the evening and the pediatrician's office not open, make sure you call the after hours exchange or go to the ER. Or an urgent care is okay, but again, if there's a true fever, there's a good chance you actually need to be in an emergency room, not just an urgent care. An urgent care, if they actually see it and confirm it's a real fever, will probably send you to the ER. So that's fever. Other things you need to call us for: 2 poor feedings in a row, just won't latch or suck at all if you're breastfeeding, or won't take any formula at all twice in a row. We want to know about that. Less than 3 wet diapers in a day. Again, less than 3 wet diapers could be a sign of dehydration. Really important for your pediatrician to know about it. Projectile vomiting, that vomit that shoots across the room, especially if there's any green color in it, or if there's any, like, as I said, the bright green color, or if there's any blood in it. We need to know about that. Or if it's, again, that projectile vomiting shooting across the room. Difficulty breathing is another one we want to know about. Noisy breathing, however, is okay. So that congestion-like noises or that can be okay. Normal for babies. Use a humidifier if you notice that. Use nasal saline and suction. Hopefully those things will help. Sometimes holding the baby upright can be helpful for those noisy breathing sounds too. If you do notice noisy breathing, you're going to look out for signs of difficulty breathing. Signs of difficulty in breathing include belly breathing. That's where the belly sucks in real deep and goes out real big and sucks in real deep and really sucks underneath the rib cages with each breath when they're calm. If they're fussy, they're going to do this, and that doesn't mean they're having difficulty breathing, but if they're calm and they're belly breathing, we need to know about it. Or nasal flaring. That's where the circles on the nose get bigger and smaller with each breath. Again, if they're calm and you notice one of those 2 things, let us know. But if those 2 things are normal and there's noisy breathing, it's probably nothing to worry about, okay? But if you want to see your pediatrician anyway, that's okay. So, difficulty breathing or any other big concerns, call us if you have any big concerns, new rashes, new problems, anything at all, let us know. We'd be happy to help you. A few other things that we usually go over on anticipatory guidance is going to be those safety things. I'll quickly go over those now, but we kind of talked about them in the history. So those are going to be things like making sure you have a rear-facing car seat, and that's until age 2. Avoiding sun exposure at this age is going to be important. Setting that hot water thermostat to 120 or lower. Do not smoke. Get smoke detectors, carbon monoxide detectors, fire extinguishers at home. Know never to shake a baby. You can walk away and come back. That's fine. Avoid large crowds. No sick people coming over to your house. When people do come over, small groups, washing their hands, wearing a mask. If they have any symptoms at all, they should not come over. Feeding. If you're formula feeding, make sure that you're mixing the formula correctly. Never add water to try to make the formula last longer. Too much water in baby formula can cause seizures. Really important to know that. Mix your formula correctly. Follow the instructions on the can. If you have questions about mixing it, call. We want to make sure you do it right because it can be a serious issue. I've seen lots of babies in the hospital who had seizures because of mixing formula incorrectly. Other things in terms of safety for feeding, at this age they should only have formula or breast milk, no water, no juices, unless your doctor specifically mentions that to you. Again, that's super rare that your doctor would, but if your doctor does mention that to you, it can be okay, but at this age I would not recommend it. So no water, no juices, no honey until a year of age, no rice cereal yet. 4 months is usually the earliest that could be safely added to bottles. No baby foods yet. We hope you wait till 6 months to start baby foods, but again, before 4 months, it is not safe, okay? So those are a few safety tips that we talked to you about at the anticipatory guidance. The next thing that we would say is that if you haven't gotten the birth certificate done or gotten the social security number, and let your insurance company know about the baby, you need to make sure that stuff all happens. Parents and anyone who's going to be around the baby should have the Tdap vaccine. Again, that's the tetanus, diphtheria, and acellular pertussis. The most important one of that vaccine is the acellular pertussis, also known as whooping cough, because if babies get whooping cough, they will stop breathing. Babies can die from whooping cough, okay? So really, really important. Whooping cough, it has a classic pattern of cough, 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 and then a whooping sound as they breathe back in. For babies, adults don't always display this. Adults sometimes just display what we call the 100-day cough. So especially if you had an adult around you who's been coughing for 100 days, over 3 months, probably not a good idea to have that person around your baby at all, because they could have it. The reason why all parents and anyone around the baby needs to have this vaccine is because the baby's immune system is not ready and the baby's not old enough to get the Tdap vaccine themselves. So that's going to be really, really important. Seasonal flu vaccine, it would also be good. Again, it's not mandatory, but also be good because if you give your baby the flu, they'll probably end up at the hospital at this age because they're not ready to fight it off yet. So I recommend this flu vaccine for all parents. Again, it's just a recommendation. Vitamin D, we'll talk to you about that. 400 international units. It can be regular vitamin D or the Polyvisol with iron. What's Polyvisol with iron? It's like a multivitamin drop with iron. The iron is to prevent anemia, which we talked about before. Very important. For my baby Harrison, we're doing the Polyvisol with iron, but vitamin D drops are okay as well. They need 400 international units per day. The next visit's going to be at 2 months of age. You can schedule that out on your way out today. You can schedule that a little early, so when he's a little before 2 months of age, but they have to be 6 months or older, and that's because of the vaccines, okay? They cannot do that 2-month visit before they're 6 weeks old. The vaccines that are due at the 2-month visit, again, if you have questions about vaccines, talk to us. We'll be happy to give you any information that you have, talk to you about your concerns, any requests that you have regarding vaccines. We're happy to talk to you. The 2-month vaccines, though, are all required by the state of Missouri, especially you're not going to be able to enroll in school without them unless you have an exemption. And I think they're safe and effective, and they're so important. We only require the vaccines that save lives. The ones that don't save lives, that are just prevent mild illnesses, things like the flu, are optional. There's a couple other adolescent vaccines that are optional too. But again, these vaccines save lives. They're safe and effective. I had them when I was a child. I'm giving them to my baby when Harrison turns 2 months old. So again, I recommend all of these vaccines. But just to prepare you, the ones that they'll be due for at the 2-month visit, there'll be 3 vaccines, which are 3 shots in the arm, which is a lot nicer because when we were kids, there's a lot more than that. They have combined some of these shots into one, which is great. The first one's called the Pentacil. It's one shot that prevents against 5 different diseases. We'll talk about all those real quickly. The first one that prevents against is diphtheria. That's a sore throat infection that causes the throat to swell up all the way closed, and you cannot breathe, and people die from that. Luckily, since we've introduced this vaccination in the United States, it's been super effective. And we haven't had any deaths in the United States for over 20 years, to my understanding. So diphtheria is great. Tetanus. Tetanus causes an illness called lockjaw or botulism in babies. Tetanus, adults have to get a booster every 10 years. Also, if you step on a nail, that's one way that adults get tetanus. Babies can get this from honey. That's why we don't recommend honey until they're a year old. And babies get something called botulism. And that causes very floppy babies who can't even breathe. And babies do die from that, so really, really, really important vaccine. Then that acellular pertussis, also known as whooping cough that I described before. When I worked at St. Louis Children's Hospital, I saw 3 babies who had pertussis or whooping cough. All 3 needed to be hospitalized. They did do well with great medical care, but they did require hospitalization, so really, really important. The other illnesses that this Pentacil vaccine prevents are polio, which we haven't seen in the United States for a long time now, but polio can kill people and can significantly alter their lives with paralysis and other problems. So polio is so important, we don't want that to come back. We recommend it for all patients. And then the last one's Haemophilus influenza B. That's one germ, a bacterial germ that causes some ear infections, some pneumonias. Again, it won't prevent all ear infections and all pneumonias because lots of other germs can cause those infections too, but it has significantly decreased the number of ear infections and pneumonia since we started vaccinating kids for Haemophilus influenza B. So that's the Pentacil 5-in-1. Wonderful. When we were kids, we got at least 3, some of us may have even gotten 5 different shots to prevent us from those 5 illnesses. So that's great. The other 2 shots in the arm, that are arm or leg that the baby will get today, number 1 is the second hepatitis B. The first one was given at birth. The next set will be given at 4 months. And then the last one today will be the pneumonia vaccine. So the pneumonia vaccine, of course, prevents pneumonia. So those are the shots in the arm. There's one other immunization that we do recommend at 2 months. It prevents something called rotavirus. It's a drop in the mouth. So it's not actually a shot in the arm. It's just a drop in the mouth. And that prevents a diarrhea illness that lots and lots of babies got in the past before the vaccine. Although it didn't kill many babies, it put lots and lots of babies in the hospital for dehydration. They lost so much fluid with diarrhea, with loose stools, that they become dehydrated and need IV fluids in the hospital. So this has prevented lots and lots of hospitalizations. It's just a drop in the mouth. It's a good vaccine. I'm going to give it to Harrison. I think it's very, very important, very effective, and essentially no side effects. I have never heard of anyone have a side effect from rotavirus vaccine. Of course, if you look at the label, they will mention a lot of things, again, rare to have any side effects from any of these vaccines. Low-grade fever, sometimes we see. Sometimes it can be a little fussy right after they get the vaccine, but usually kids calm down before they even leave our office. And a lot of parents tell me that they're tired for the rest of the day. They sleep really well. Parents seem to like that. But parents say that patients do well. I haven't heard many complaints at all about side effects for vaccines. No major side effects at all. Usually we get maybe a low-grade fever. That just means the vaccine's working. Your body's immune system is fighting off that vaccine, and that's what causes the fever. So that means that the vaccine's working really well. Not necessarily a bad thing if there's a fever after a vaccine. And every once in a while we might see a little redness around the site. Rashes, not with these vaccines, but the ones we give at a year, we sometimes see some rashes with. But again, side effects are minimal to none. So safe. I'm sure your baby will do well, but if you have questions, ask us. So those are the 2-month vaccinations. The other things to know is that we will give you this handout here. Again, it talks about everything we talked about, fever or illness. It talks a little bit here about what to do with that noisy breathing, that congestion breathing. That's normal. Sneezing is also normal at this age. Talks about normal poop and pee. Talks about normal sleep. Talks about healthy habits. The book suggestion that I give at this age is Happiest Baby on the Block by Harvey Karp. Really great book. What it does, it talks to you about how to soothe fussy babies. So again, a summary of that real quick. Number 1, check to see if they're hungry. Check to see if they have dirty diapers. Check for rashes. Make sure they didn't spit up on themselves, because if their skin's wet either from spit up or urine or from feces, that's going to cause them to be fussy. Look for all those things. If all those things are normal, then we're going to do what Harvey Karp teaches us to soothe fussy babies. It's called the 5 S's. So you're going to use techniques like swaddling the baby, swaying the baby, sucking on a pacifier, side or stomach position, and shushing noises. Using those all together can help calm fussy babies. If you're concerned that there's a medical problem causing this baby to be fussy, call us. We're happy to do exams to make sure there's no medical problem. But just so you know, it's very, very common for babies to be fussiest between 3 weeks of life and 3 months of life. Okay, so this is coming up soon. We recommend the book Happiest Baby on the Block. There's an audiobook version of that too. So I think that's all the information I had today. Hopefully you found this helpful. If you have questions, give us a call. Our number is 314-838-7912. Again, that's 314-838-7912. Have a great day. Bye.